Well, the treatment for ADHD should always, always, always include education, and that's where it should start. Most people think they know what ADHD, very few people think they know what ADHD is. Most people don't. They think of a stereotype, hyperactive, disruptive little boys, and they only understand a sliver of the condition. So I always begin with education. I explain to them the full breadth and depth of this condition, that it's a kind of mind, if you will. It's a way of being in the world that affects pretty much everything you do. So I take a fair amount of time to dispel misconceptions and to help people understand what it really is. Because if you're going to learn to manage it, you got to own it and not think of it as just a list of symptoms. And I encourage people to read my books. Delivered from Distraction is the most recent, and I encourage them to do that. I encourage them to talk to other people who have it. Education is the cornerstone of living with this condition, and it's a step that most of the time is just skipped over. So education, 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 step number one. And then you want to look at lifestyle modification. Where are you falling down? Is it with executive function? Well, then you need to get some coaching. You need to get an organizational specialist. You need to get a tutor. You need to set up a reminder system. You need to get an alarm clock that will actually get you out of bed. I mean, these sort of lifestyle modifications, if you're not sleeping, you need to get on a sleep schedule so you'll get enough sleep. Physical exercise is huge. Physical exercise is one of the absolute best things you can do for your brain.